Hey everyone, Preston MP here. As a practicing clinician, I see all too often patients raising the alarm bells over an elevated A1C, and on the flip side, there are those that are falsely reassured by it. A1C is a useful tool, but what the heck does it really mean? Well, we're going to break that down to you and tell you what it does mean and what it doesn't. So what exactly is an A1C? Before we get into all the details, I think it's important to understand our terminology here and what it is we're trying to measure with the tools we're using. So an A1C is a test that your doctor may have ordered if you're a diabetic that measures an average blood glucose saturation over a span of 3 months. Now, if you get down on the cellular level, what that is saying is we're taking those hemoglobin, that's those blood proteins, and we're measuring the percentage of those that are coated like a piece of candy. They're coated in sugar, they're saturated with it. Really, in simple terms, we're measuring how saturated your blood is with sugar over a 3-month span. Now, there's some nuance to this, such as those blood sugars towards the end of the 3-month period way heavier than the ones at the beginning. And this is an average, so it doesn't tell us what you're typically trending. For example, you could have half the time that you have a blood sugar of 50 and half the time you have a blood sugar of 300. And your A1C says that we're normal because we have the average, but what it doesn't tell us is that individual is experiencing highs and lows. So there's important clinical implications here and important things you need to know about your health and how to use this A1C to appropriately guide your care. Now, an A1C is important, but it's not the tell-all. I think it's very important for all diabetics across the board to look into a continuous glucose monitor to see if it's something that may be appropriate for them. One of my favorite things to give out is our continuous glucose monitors. That's our Freestyle Libres, our Dexcoms. They're fabulous. So what these are devices that sit on your skin. So you'll apply them once every however many days the manufacturer recommends, typically a week or 2. And they measure your blood glucose continuously within the fat space. So small needle, and I almost hate to call it a needle because most patients tend to not really feel it, goes to the back of your arm in that subcutaneous space, in the fat space that is, and it measures your blood sugar continuously. The cool thing about that is you can actually link family members to see when you get lows or highs. So if you're in those emergency situations, they would be able to be alerted. But more importantly, you get something called a time in range. Your time in range is your percentage of time when you're in the restricted range that your provider gives you. For example, typically I like my diabetics to be between 130 and 180. Less than 130 if they're fasting and less than 180 if they're postprandial or just eaten. These can fluctuate depending on what guidelines you go by, but I typically go by the American Diabetes Association for me personally, and that's what we've used as a guiding principle. So now we understand that there are some other tools out there for diabetics and people struggling with their blood sugar. So now that we know those exist, why do doctors care so much about A1Cs? Well, this is an excellent question because what we know from the latest research in medicine is that reduction in A1C drastically reduced complications and other comorbidities. What that means is the data shows us if we can get that A1C down a percentage point, for example, we have seen 35 to 40% reduction in microvascular complications. That's the cardiovascular, peripheral vascular system. So yes, diabetes can cause circulation issues. It can cause neuropathies. It can cause retinopathies, problems with your eyeballs. Without a controlled blood sugar, it can really hinder your health long term. So getting that A1C under control is very important. And this is why doctors and me as a nurse practitioner fully support measuring that A1C and keeping it under control. So long as that we understand its role in the clinical situation and what it really implies for your health. If you truly enjoyed this discussion on A1C today, make sure to give us a like and subscribe and leave a comment down below on more things that you would like a board-certified nurse practitioner, myself, Preston Holyfield, to discuss. And I would love to dive into those topics together as we're hungry to learn and grow together. So here's where we get to the hot take of the day. What does A1C not show? And this is a very important question, so I hope you're listening closely here. An A1C does not show highs and lows. It does not show hypoglycemia risk. It does not show post-meal spikes. So I have individuals that I personally seen as a clinician that they had a wonderful A1C, but they were still having issues because we weren't getting the full picture just from that lab alone. With that, this is why I push so hard continuous glucose monitors, because these are the ones that are gonna give you real-time data telling you if you're having a low or a high. These are paramount to health and ongoing surveillance. One thing I hope you all leave here with today is that A1C is important, but it's not the whole picture. So you have to see the whole picture, have to get those blood sugars. Very, very important. So I think I've dogged on A1Cs quite enough, so let's get back to the positive here. If your red blood cell lifespan's altered, it's important to know that your A1C may not be accurate. What that means is people suffering from chronic diseases, maybe they have sickle cell, thalassemias, maybe they're pregnant, maybe they have some sort of anemia. These can alter the red blood cell life cycle, thus altering the hemoglobin, thus altering your A1C. So if A1C is off, it may not always be the A1C's fault. Sometimes we can have other precipitating events that can cause these alterations, so it's important to be very cognizant of this. So it's important to take a holistic, individualized approach in every patient's care and engage in shared decision making. Very important that we understand how the body is working and if the individual is healthy and suffering from other chronic condition. Often in primary care, we do intake forms and do comprehensive health histories to better understand this before we really stick our flag in the ground and say, this is what the A1C means. So your A1C, in short, is the report card, and your continuous glucose monitor is your daily report. Both are important, and together, they make a beautiful marriage. But all that said, last thing I want to leave you guys with is your body doesn't care about decimal points. It cares about patterns. And we as clinicians try to understand those patterns through various tools like A1Cs. These are tools, not verdicts. So if you hit a bad number on your A1C, this doesn't mean you're a bad person. It doesn't mean you're a healthy person. It means that we need to take careful, close attention to your health and put it into perspective of you as a person and the conditions that you may or may not be struggling with. This is your call to action. Talk to your doctor, bring these to their attention. This is something that you're concerned about, or maybe you do or don't understand what an A1C really means for your health and need some help navigating this. Maybe you heard about the continuous glucose monitor and really want to dig deeper into this. All great things. Make sure that you talk to your doctor about that. That's what I'm gonna leave you with. So if you've made it this far, I hope you guys have enjoyed it. I really like making these videos, so if you would like me to continue doing so, make sure that you share, like, comment on more things that we'd like to discuss. It's been an absolute pleasure sharing all things A1C, blood sugar, and diabetes with you guys, and I look forward to many more videos together. As always, modern medicine with a nurse's heart. Preston MP, out.